August of 2020, last year, I noticed that I had some vaginal spotting. I really just thought maybe I had scratched myself or something. I didn't really take it serious. Then I started to notice I was bleeding. It was more than just spotting. So I went to see Dr. Hankey, and he ordered the vaginal ultrasound test and saw something, and he talked to me, and he said that something was growing that shouldn't be growing, and that he wanted to do a biopsy. So he scheduled the biopsy, which was done March the 5th. And by March the 16th, I got a call from him that I did have endometrial cancer. At that point, it was just a grade 1, but it hadn't been staged. I can remember driving up to the cancer center over in Newport News by the big Riverside Hospital and just thinking, I'm going to a cancer center. Dr. Irvin is great. He walked in there, he was very encouraging, very, thorough. He took as much time as I needed to explain everything to me, and said that the best thing for me would be to have a total hysterectomy. When he did the surgery, the endometrial cancer had not spread. My lymph nodes came back clear, and it was staged at a 1A. He told me, he said, you only got a 2% chance of it coming back. He said, so I feel like you're cured. Please just go get it checked. The biopsies aren't that bad. They might be a little uncomfortable, but it's really not much to it.
Cancer that forms in tissues of one or both testicles. Testicular cancer is most common in young or middle-aged men. Most testicular cancers begin in germ cells that make sperm and are called testicular germ cell tumors.
It was December, just before Christmas, December 2002. I actually had made a doctor's appointment because I wasn't feeling myself over the last few weeks. And so I went to see my general practitioner doctor, and went in, had back pains and other things like that. I had one testicle that seemed to be larger than the other, and so he asked to do an examination, and it was a very quick examination because he says, okay, well, let's take a look. And it took about 20 seconds. He said, all right, I'll be right back. And he leaves the examination room and comes back a few minutes later. He says, well, I've just made an appointment for you to go over and see this urologist across town. So you need to be there in an hour. Well, that's a little strange. So I went over and saw the urologist, and he did essentially the same thing. But at that point, I was pretty prepared for what I was about to hear. I really had a fairly good idea what was going on, and we had to set up a surgery to have that testicle removed. The most difficult thing, I think, was having to tell your family. A wife, at the time, we had one son who was 1.5, and we were expecting. My wife was 4 months pregnant with our second. It's really difficult to, how do you begin a conversation like that? Throughout the diagnosis, I had to go through a series of MRIs and additional tests to find if the cancer had spread, which it had. It spread pretty extensively up through my abdomen, onto my liver, and into my lungs. They did an MRI on my head, and they didn't find anything there, so I was lucky that way. But the standard protocol for our treatment for my particular type of testicular cancer was chemotherapy, and so I started that in middle of January 03, and it was basically a 3-month regimen where I'd go in every day for a week, and then the next step would be to do surgery to remove any residual tumors. The problem was that the tumors in my lungs hadn't shrunk enough to where they could actually operate on them. So the decision was made to wait after chemotherapy to see if the tumors would continue to shrink. Some did, and they started getting better, but by late spring, early summer, my tumor markers, or the cancer, started to become active again. So we opted to do surgery and did that. After the surgery, my tumor markers were normal, and so there was some optimism that they'd gotten all the cancer and things were going to be better. By November, my tumor markers came back up, so the cancer was active again. And so that's when I was referred down to the SCCA to evaluate my conditions. So the type of treatment that was opted to do next was not available in Bellingham, where I live. The protocol that was determined was what they call high-dose chemotherapy and a stem cell transplant. It's very, very aggressive, and since then it's been clear. It's very much on the cutting edge or front side of a lot of the treatments. So the communications that the doctors have at the SCCA are global instead of regional, you might say. The thing that was most remarkable, I think, of my experiences there was the empathy that the staff had. It was truly amazing. You have to be proactive. You have to understand and manage your care. You can't just hand it over and figure it's going to be okay. In other words, don't be a patient. You know, you actually have to be an advocate for your own health and take care of yourself. Lastly, I think it's very important that you don't let cancer define who you are. Remember who you are and remember your life before your diagnosis and who you want to be. I had really good chances when I was first diagnosed. I mean, it's a very curable disease. When it comes back, your chances go down quite a bit. It does go to show the technology that we live in and the modern medicines that we have it's a good time to be alive. It's not always a terminal illness anymore. It's something that is treatable and curable.
As was discussed in previous concepts, both infectious and non-infectious phase therapeuticus may be very serious, but there are ways to keep your reproductive system healthy. What can you do to keep your reproductive system healthy? You can start by making the right choices for overall good health.